blood, clot those capillaries so they can begin to heal, create the little scab, and then let healing occur. And the goal is hopefully that it does that without any major infection sitting in and you lose your finger or something, you know. Because, I mean, that can happen, okay? I mean, you know, think about it. So, as the repair continues, we have to make sure that that area replaces and heals, all right? Do any of you have maybe scars from things that might have happened? Okay, all right, I got a bunch, okay? Now, here's what happens when tissue heals, okay? Sometimes, if there's been a breach for tissue damage, we can see that the tissue healed. You don't see any remnants of any type of damage, and it continues to work fine throughout life. It continues to go through mitosis. It continues to do what it's supposed to do. If that's the case, it is considered labile. If there's been tissue damage, but as the tissue healed, it can't do any more type of mitosis. In other words, that area has been damaged in some way. It can't continue with normal processes. It could be considered stable. The cell might actually still be working, but we can't get any more mitosis or anything afterwards. Now, if the tissue damage results in scarring, if it results in something left behind that is a remnant of that damage, that means it's no longer working. The cells are not alive there, okay? That area of the tissue is now dead, okay? This would be permanent. This is what can happen to nerves, depending upon where nerve damage might occur, will determine if it will get any restorative properties. Some skeletal muscle, if it is cut too deeply or damaged too severe, there can actually be a section of that muscle that no longer works. People who have heart attacks and survive, that area of the heart that was damaged does not recover. Those cells in that area of the heart are now dead. So if it's a permanent tissue damage, there is no recovery to those cells. Which one?
How did you describe the stable one again?
The stable, they're still doing everything they're supposed to do. So if you think, for example, it's but think about a paper cut, okay? You might get that paper cut on your finger and it heals, but then there's nothing else. You don't get a scar, you don't get a whole lot of pain, life goes on, okay? You guys know that I've had hand surgery. I don't know if any of you can see, but on this hand that has done healing in the areas where they did the cuts, I have scarring. So that means that tissue, it might be stable. It might still have, the ability to carry out processes. But I also have, I don't know if any of y'all have that keloid formation, okay? I have where, like this kid growing up, playing, falling off bikes, doing all that sort of stuff, I've got quite a few scars that are the keloid. And those are now permanent, meaning they don't do anything.
So are you saying the scars is what's permanent?
Scars can lead to it being permanent damage. Because if it's a big damaged area or it was damaged rather severely, chances are that's going to end up with a pretty bad scar, and that tissue can't do what it's supposed to do. And if you think about a heart attack, wherever it occurred on the heart is meaning that part of the heart's dead. It doesn't move anymore. So when we repair for the skin, okay, and these layers underneath, the goal is we want those to come together under normal circumstances where the damage is not too bad. It fills in with blood. Blood has the ability to clot. When that happens, we usually form a scab. Depending on the amount of the damage, you could get an inflammatory response, get the pus. That's just simply the white blood cells dying, okay? And then tissues begin to form, and hopefully you'll get replacement. A scar is when that area, like I said, it can be the situation where it's no longer functioning, because it could be that the capillaries were completely forced out, meaning there's no more blood supply. No blood supply, no nutrient, okay? Now, if edges are not together, all right, maybe there has to be something that will bridge the gap. Like maybe they use artificial skin, okay? Chances are that blood ability is not going to be able to close it. They're going to need the help of maybe like the artificial skin. Our inflammatory response is greater. We create a lot more fluids, a lot more pus, a lot more bringing blood and nutrients and materials into that area, and that could lead to greater scarring. Think about somebody who may have had like a burn, okay? That meant that the gap was big. They might have had to use that artificial skin to help close it. And your chances of having a scar are greater because it was bigger. So the goal in the good situations, blood fills, we form the clot, a scab forms, but it allows tissues underneath to begin healing. We begin to get what they call the granulation, but the granulation eventually helps close it all together and create the healing for the tissues underneath, and sometimes you may or may not get the scar that's left behind. Now, what's going to happen as we get older? As we get older, our ability for the tissues to heal is going to decrease. All right? As we get older, one of the things that's important, if you remember, we've got the 3 fibers that exist. We've got our collagen, reticular, and elastic. Okay? Those actually decrease as we age. Okay? And they are extremely important to the structures of our body. Whether we're looking at support to the skin, support to the organs. Okay? As we age, cells are going to divide more slowly. Collagen fibers will not only decrease in number, or, well, I guess sometimes they could increase, but the problem is they're irregular in structure. So they're not going to be functioning the way we need them to. This will definitely affect tendons and ligaments because they are high in collagen fibers. Elastic fibers begin to break apart, fragment, and because that happens, calcium ions will bind to them, and they're not as elastic anymore. That means in areas where they're very important, like the aorta, the arteries, they become less elastic and do not work as well, which is one of the reasons that as we age, blood pressure tends to go up. Sometimes people can have blood pressure go down, but the majority see a rise in their blood pressure. Usually their top number, maybe not always their bottom number, but definitely their top number. We do see that because we have these changes in the collagen and elastin, this does lead to what we call atherosclerosis, which is affecting the arteries, which is going to affect the blood flow to the tissues of the body. It ends up creating wrinkles and other issues, and in bones, causes our bones to be a little more brittle, along with some other factors. The rate of blood cell synthesis is going to decrease, and because of all of this, our injuries are not going to heal as quickly. Victoria?
Okay, so is this why like old people they start to shrink when they get older? Okay.
Yeah, because if you think about all these different types of tissues that are present, and because one of the biggest things that happens, you know, every day, all day long, gravity. Gravity is heavy, okay? And the cartilage loses the ability to be plump. And it begins, and of course that leads to bones getting closer. I mean, it just leads to a whole bunch of problems as we get older. All right, well that ends chapter 5. And you're going to just simply finish up looking at a few of the slides for Lab 5, because the only ones that were left are